Who let the dogs out?
Who let the dogs out? Who let the dogs out? Who let the dogs out?
It's time for Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice. Traditional small animal medicine and surgery, chiropractic, laser therapy, acupuncture, and Chinese herbal medicine. 518-789-3440, millertonvet.com. With us today, Dr. Carolyn Cannon, owner and chief vet at the Millerton Veterinary Practice.
Good morning, Jill.
Hello, Dr. Cannon.
Hello.
All right, questions. We all have questions, and this is from far away, Saeed in Finsbury Park, London. I'm writing from London, where urban...
That is far away.
See? You reach the world.
Wow.
I'm writing from London, where urban foxes are a part of life. I got this muddled notice from my local city council last week that I'm still puzzling over. Quote, sarcoptic mange, also known as canine scabies, is highly contagious between foxes and dogs, but treatable. The mites can be passed to humans, but they can't complete their life cycle on a non-canine host. Unquote. So the fox that comes through my back garden nightly could pass it on to my dogs, who also enjoy the back garden of an evening, but the mites themselves won't live on my dogs? So what's the problem? Are they then going to be passed along to me and my kids? What on earth?
The mites will live on the dog. So any canine host, so a fox or a wolf or a coyote or a dog, absolutely, it can cause the disease scabies. And what that means is that the mites will burrow into the skin and down deep in the skin, and they cause hair loss. They get down into the hair follicles and cause inflammation, so they cause hair loss and lots of itching. So dogs with scabies are very, very itchy. They usually lose hair. My experience has been that they usually lose their hair first on their legs, so their legs have kind of a moth-eaten appearance, and around the head as well. And then if it gets really severe, they'll have hair loss on their sides. But it usually doesn't get that bad because the dog's so itchy, they keep you up at night scratching, and you go to the vet and you get treated. Get your dog treated. It is potentially passed on to humans, but it's very self-limiting because they can't complete their life cycle. So people can get little lesions. I think most of the time I've seen it on clients on their insides of their arms. They get little red dots. But my understanding is, although I am not a human medical doctor, I said it would be treated on people as well, but it doesn't get as severe as it does with dogs because the mites don't really want to live on people.
People don't have enough fur.
Maybe that's what it is.
I just made that up.
I don't know.
I just made that up, but it seems that seems, if I were a mite, that would be my complaint.
Right. So, I think that it's likely if your dog gets mange, could certainly cause some lesions on your skin. But I think the real big concern here is that the dogs will pick up some of these mange mites from the yard after the foxes have been nesting down in that area.
Or even walking, or even just passing through.
Just passing through. Now, that being said, many dogs now are on one of the flea and tick control products, which has off-label use against mange. Those are the Credelio, Brevecto, NexGard, Simparica group. So we don't see a lot of mange anymore because so many animals are on those. Revolution, which is a topical, which also treats heartworm, is also effective against sarcoptic mange. So easy treatment with Revolution. I usually treat with Revolution topically every 2 weeks for three doses. But it's not something that you should be terribly concerned about until you see your dog start to scratch like mad.
Seems like a reasonable indicator. All right, and speaking of heartworm, Matt in Wappingers Falls, I met a holistic veterinarian the other day who told me heartworm medication is basically a huge hoax because there are barely any cases of heartworm in New York State. I checked it out, but the sources of the stats I found don't exactly seem nonpartisan. What's the story?
I like the politicalization of
Everything.
the word hoax and nonpartisan. So what I would say to that is that there are fewer cases in the north, absolutely, many fewer cases. However, there are some cases every year of heartworm disease that have been treated in dogs. I have treated dogs almost every year for heartworm. The risk, it's very difficult to tell you what the risk is. So the risk is likely low, but we can't tell you exactly what that is because it can be potentially in the wildlife population of canids. It also can be in the dogs who don't have regular veterinary care. The more dogs who are coming from the south, it's potentially a problem too. Almost all of the dogs that are adopted out these days come from the south. They're all checked for heartworm disease. The problem being is that the heartworm check is typically for the surface proteins, the antigens on the adult female heartworm. And so you can have because heartworm disease is so endemic in the south, your dog could get infected with heartworm on any given day. That, it's possible to have an all one-sex infection where they have just the males, but that's not going to, of course, they're going to produce baby heartworm, so it's not going to affect the mosquitoes in your area. Your dog won't get in trouble from that. But what happens is that sometimes they'll test these young dogs and they don't have the adult heartworms yet. And so they come up negative. And so it's important that veterinarians up here check them again 6 months later, and that doesn't always happen. So sometimes we do get dogs who are heartworm positive from the south. The other way that I look at it is, your risk is darn low also of getting into a car accident, and yet every time we get into the car, we put our seatbelt on. And so we have a good way of preventing death from a car accident. We have a really good way of preventing death from heartworm disease by a once-a-month, very well-studied, tiny, tiny bits of either ivermectin, selamectin, or moxidectin. These are in the heartworm preventions. And that can 100% control heartworm in your dog. Not a bad idea. You also don't have to worry about traveling with your dog, which most people aren't doing these days, if they're on heartworm prevention. And then the next thing is that these heartworm preventions also help to control intestinal parasites. So the dogs who are on that once a month, their noses are to the ground all the time. Goodness knows what they're eating and sniffing up. And so you can help to control the passage between dogs of intestinal parasites with these once-a-month controls. So everyone is absolutely, just like anything else I always talk about on the show, is it's risk versus benefit. You have to make up your own mind what sort of risk that you're willing to encounter. And if, in fact, you don't use any prevention, then my recommendation to people is to at least test your dog twice a year, because you don't want to have a dog with advanced heartworm disease that you would have to treat. It's really not pretty. The treatment can be really difficult on them, and you have to keep them quiet once they have heartworm. You've got to rest your dog and keep them on a leash for 2 or 3 months.
Yeah, just one of the things that always is frustrating is, this is a personal thing, holistic veterinarians are absolutely wonderful. So it just takes an edge off. I used to have this in California years and years ago. He's like, you'd say something, and if you do I'm going to call it a right-brained risk reward analysis, you might come up with a different. It might just be, look, it's here, it's easy enough, and it saves it. The one, it's insurance.
Yes, to a certain extent it is. And when you look at ivermectin that's in HeartGuard or the moxidectin, these very, very tiny amounts of medication in them, that the half-life of ivermectin, which means that the time to which it's the amount of it in the system is cut in half, is only about 3 days. So you're not giving something that's lasting for the month. You're giving something that's going to kill, in a tiny amount, that's going to kill off any of the appropriate stage baby heartworms, so that they won't grow to be adults and lodge in the heart. And so in my book, I give it to my dogs, and I give it to them year round, because I have a hard time
remembering what month you did.
Exactly. Plus, their noses are in everything. We have a place where we walk, where they run free, and they eat anything, absolutely anything that they come upon. So it helps with the intestinal parasite control.
All right. Eli in New Paltz, my 2-year-old Basenji Theo is extremely sensitive to chemicals, especially flea and tick preventatives. But ticks are a real problem where we live, so he wears a Seresto collar. Now that winter is here, can I take it off until spring? My other idea was maybe just putting it on when we go outside, but taking it off when we're indoors.
Well, the Seresto collar doesn't work that way. It needs to be left on and in contact with the skin in order to be effective. So it actually reaches its most effective, its highest effectiveness about a week after you apply it. So it's not a good one to be taking on, to be putting on and taking off. Even if you wrap it up in a in a tightly sealed plastic, you can certainly, if you're feeling like you don't need to have it over the winter, you can do that and put it back on. Maybe skip a few months when the snow is heavy on the ground, as long as your dog isn't having contact with any other dogs that might have fleas. So what you don't want to do is bring a flea into your house, because that can be a nightmare. Now, the fleas don't survive that well in the wintertime either. Nevertheless, I'm not willing to take a chance with that. So yeah, the ticks right now, I'm not seeing any ticks. If we have 3 consecutive warm days and you're walking your dog out in the woods, they are going to get ticks. We just don't know. We can't predict the weather these days. So I guess what I would ask is, if Theo's extremely sensitive to chemicals, would Brevecto be a better option for him? Yeah, so I'm not sure what this little Basenji has been sensitive to before. I think that there are other ways to do this. The Seresto is it's simply a different chemical than what's in Brevecto, but Brevecto has been proven to be pretty safe. Can be given to it's not to be given to any dogs who have seizures, but it can be given to even a pregnant female. So it is a fairly safe drug. The Brevecto is a 3-month. Actually, they have a 1-month pill now for puppies. Credelio's 1 month. NexGard's 1 month. So in other words, you have to give it every month. So I do tend to keep my dogs on it because of the potential. Actually, every year we've had days in the middle of winter where the ticks are out again, because I've gotten them myself. So depending on the lifestyle that you have, if you have a little teacup poodle that hardly ever hits the ground and you're not walking in the woods, then absolutely, you don't need to keep up with the flea and tick prevention theoretically. With a Basenji, they are active dogs and they want to go. So depending on what you do with Theo, I think a good recommendation would be to have something on him all the time that's going to potentially control ticks.
Okay. And in that case, maybe it wouldn't be the Seresto collar.
Right.
Or maybe
it could be
Seresto.
It would be. Seresto works well. Is that going to be any worse than any of the feed-through ones? It's sort of comparing apples and oranges.
Right.
I think whatever you can find that he doesn't have a reaction to is okay to use if you're comfortable with using it that way. I, as a veterinarian, you could certainly, if the weather gets warm, stay home and not walk your dog. So again, you really have to consider what is your own risk and what are you willing to do with your own schedule, or are you going to be okay with taking the risk of bringing fleas into the house? So all of those things versus introducing or having your dog on or a chemical in them or on them for a long period of time. I mean, the environmental chemicals that we deal with every day are out there, and all of us deal with them, and we don't have any choice. And so you need to, as an integrative medicine a doctor, I have to tell people that you need to make those choices, risk versus benefit. I have other holistic veterinarians friends who say absolutely no chemicals, and they're fine with picking off all the ticks and treating their dog constantly for Lyme disease or trying to keep them as healthy as possible so that they don't get Lyme. But it's a lot of work, and it is you have to be willing to have a flea infestation in your house as well. So all of those things need to be taken into account.
And what's important about mentioning them is that in things like this and in discussions that people tend to get into, not everything is laid out that way. It's like you get a couple of, well, there's this and this and this, and it's oh yeah, it's ducky, and then a buzzkill like me will come along and say, yeah, but you're like, yeah, but
sure, it would be lovely if we didn't have to use any of these products. It would be really nice in a perfect world.
Yeah, and unfortunately, there are creepy crawlies out there that are easier to, sometimes mitigate if you. You just find, as you pointed out, you find what everyone can live with. And that's
exactly, because there are more natural things that you can use. It's just a lot of work and a lot of research, and see what works for you, and applying something every day. And so there definitely are other ways you can go. It's just you have to decide whether you're going to be able to put that work in.
Right. And to that end, just so you know, I was rootling around closet, and I found a natural. I apparently at one point had bought a case of natural flea collars. And I still have
those
them.
don't work.
Yeah, obviously, I must have figured that out along the way. All right, Autumn in Danbury. My cat has been diagnosed with IBD. That in itself is pretty overwhelming, but then a friend who does cat rescue mentioned that cats with IBD can go on to develop gastrointestinal lymphoma. My circuits are overloaded with information, but can you please clarify whether this is really the case and whether anything can be done to prevent her IBD into turning into something even worse? She is 4 years old, a spayed Himalayan.
So IBD is inflammatory bowel disease, and there is evidence that there is a progression of symptoms and age and time. It can turn into lymphoma. It's actually difficult at times for the pathologist to determine whether your animal, if you did a biopsy, has a severe case of IBD versus lymphoma. So these inflammatory cells, because of foods that are ingested, the inflammatory cells are set up to actually, as a reaction, basically, to these foods. If everyone's probably heard about leaky gut syndrome, there are reasons for the gut no longer to be a strong barrier between your food and your bloodstream. And when that happens, then the proteins get introduced to the bloodstream, get introduced to the gut-associated lymph tissue, which is your immune system along your intestine. And the immune system sets up this barrier of inflammatory cells and can cause all kinds of it. It can make the gut, your intestines have difficulty digesting food. So the diarrhea, weight loss, vomiting, those are the symptoms of IBD. And so, yes, with time, I can tell you that in my 30 years of experience, most of the time that doesn't happen, but it can happen. The best thing that you can do to prevent that from happening is to control the symptoms of inflammatory bowel disease. And the best thing that you can do to control the symptoms of inflammatory bowel disease is you need to figure out with your veterinarian and feed a food that doesn't initiate an inflammatory response. So you can do all kinds of drugs, absolutely, and control it, which is the second best thing. The primary thing, if you can, whittle it down to getting your cats to eat what you want them to eat so that they don't have this inflammatory response. Difficult to do at times.
Right, and then it's a cat.
Right, so sometimes, and cats don't want to eat what you want them to eat to begin with, and then when they don't feel great, they really don't want to do that. But there are all kinds of potential limited ingredients diets and now hydrolyzed protein diets. The important thing is to quell that inflammatory response so that it doesn't get worse with time.
Right. And so so if someone were really if someone were really as overloaded as Autumn sounds, what would you recommend a diet discussion with a veterinary nutritionist or with her veterinarian? Or
I think that the diet discussion it's a tough discussion because I can tell you that it goes on for days and days and hours and weeks, and it's try this. Well, my cat won't eat this. Well, try to introduce it this way. Well, I can't do that. Well, meal feed, don't, I have 10 other cats in the house. So it's a conversation that is difficult. And so absolutely push your veterinarian into having that conversation. How can we do this? And you need to be willing to make it happen. So if, in fact, Autumn is the only kitty, it's a lot easier to make that happen. And there are, for limited ingredients, there's rabbit, duck, venison formulas that have also limited ingredients, meaning there's not lots of varied ingredients. So you can sort of try to do what's called an elimination diet by eliminating chicken, eliminating fish, etc., with one of these novel proteins that we hope that your kitty hasn't had before. There's also alligator now. They make cat food out of alligators. And there are also hydrolyzed protein diets, which are diets in which the protein is broken down to molecules that are too small for your intestinal, your gut-associated lymphoid tissue to recognize as foreign. And so you have lots of options dietarily. And sometimes I'll have to do medication to get kitty feeling better and get them eating what you want them to eat, and do that for a couple of months and then gradually wean off the medicine, trying to wean off the medicine to keep them eating what you want them to eat.
And a quick final question is, if you have multiple cats in the house, does anything preclude them eating that limited ingredient diet as well?
No, they can usually eat it as well. It's just that it's going to be more expensive than
right. No, I understand.
Most people feed. Absolutely. So unless they have other medical issues, they can usually eat the same diet. There are also feeders now that come with a chip that will only allow the animal carrying the chip on the collar to get into the feeder. So there are ways to get around these things. It's not a simple fix.
Ooh, so basically, you've got to amortize the cost of one of those feeders over how much the extra food costs. It's all about
exactly.
It's all about figuring it out. But there are options, and the most important place to go with that is diet to avoid the. To
avoid the stimulation, right? Of instead of feeding a diet that's going to be constantly stimulating the immune system, and then having to quell the immune system with potential side effects by those drugs, then the best thing to do would be, if you can, go with a diet that's not going to stimulate the immune system. To say,
hello,
food, get out of here, one way or the other.
All right. Thank you very much, Dr. Cannon. We really appreciate it. This has been Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice, 518-789-3440, millertonvet.com.
Who let the dogs out? Who let the dogs out?